Cancer treatment in Gauteng remains in the spotlight as we observe Breast Cancer Awareness Month. This morning, the AM report is visiting 2 hospitals in Gauteng to look at the state of healthcare facilities in the province. And that's, of course, in a bid to to identify challenges and treatment options that are available. My co-anchor, Michelle Craig, currently now at Helen Joseph Hospital, and she joins us now live. And Michelle, we've already heard how the CEO at that institution is potentially entering a rat's nest because of just how complex the issues there are.
Yeah, very good morning to you indeed, Ayanda, and to our viewers as well. And of course, you're talking about the interview we had earlier with Louise Turner, the director of the Breast Health Foundation, who departed, that organization having departed the breast care clinic here at Helen Joseph Hospital just last month. I'm going to begin our interview immediately and bring in the CEO of Helen Joseph Hospital. That's Dr Relebohile Ncha, who joins us here this morning. Dr. Ncha, it's great to have you with us on the program.
Thank you.
I want to begin by perhaps, and your department has already gone some way to dispel the rumors around the availability of breast cancer treatment at Helen Joseph Hospital. As far as you can tell us this morning, it is continuing despite the departure of Dr. Carol Ann Ben and the Breast Health Foundation.
Yes, definitely. Yes. So unfortunately, with the departure of Prof. Ben, there was some miscommunication in terms of the clinic being opened or even breast cancer services being provided at the hospital. But yes, we're here to say it is fully functional and operations do continue, and we do have staff that are actually looking after our patients and continuing with the care that we're giving for Helen Joseph Hospital.
That's not to say that the Breast Care Foundation hasn't left a gap somewhat in helping patients to navigate cancer treatment, specifically breast cancer treatment, at our public hospitals in Gauteng.
They've been here for about 17 years, so for sure they have a legacy that they've left behind. And yes, their sudden departure also created a bit of a gap for us, but we've ensured that at least all our services do still continue, and we are in the process of negotiating with them and even looking at other service providers who can actually come in and assist with continuation of that treatment.
The Breast Health Foundation, who we spoke to at 6 o'clock this morning, they provided their services to the hospital on a voluntary basis for the 2 days a week that they were here. So if you're going to find a way to fill the gap that they've left, that money will need to come from the hospital then.
That's why we're actually embarking on a similar path to find an organization, an NGO of some sort that can also volunteer their services.
You're not looking to get them back?
Look, we are in negotiations. I think Louise has also mentioned that we are in talks with them. But again, we're also, putting our net out there to get any other foundation that can come and assist us as well. But it would be great for them to continue with the work that they started at the hospital.
Absolutely. I see messages. There's a notice board here behind us. Yes. And I see so many messages from patients who were served here at the breast care clinic at Helen Joseph Hospital, naming the foundation and naming Professor Carol Ann Ben, saying, attributing their survival to, in part, the work done by Professor Ben. That must have been a major loss for the hospital, and I wonder why you would have allowed that to happen.
Well, it is a loss because Prof. Ben is the one who actually started this clinic in 2005, and she's really been the face of Helen Joseph Breast Cancer Clinic. Unfortunately, yes, I tried to negotiate with her to stay, but because of whatever issues that they were having, she then opted to say, let me leave, and then we'll then have to continue with other people. It is really unfortunate. I did try to speak to her when she sent it through her resignation letter.
So you say she chose to leave due to whatever issues. What do you understand those issues to be?
Look, I do understand that there were some work relationship issues with her manager back then. And from what I understand, it has been continuing for a while. But unfortunately, it came to light on my side when she sent through her resignation, and I actually had to sit down with her to try and understand what the issues were, because I was not really expecting it. It was like a sudden thing. I was not really expecting it. But I think she did indicate, and we did have a chat about it, and it's really something that we're working on to prevent such from happening in the future.
We spoke to Dr. Professor Carol Ann Ben last week in our program in studio, and she described to us a situation of near disaster insofar as cancer treatment in the province is concerned. In fact, she talked about taking patients for surgery here at Helen Joseph Hospital and having no drains available for their surgery, no stitches available. And those surgeries having to be cancelled, or Professor Ben herself having to source those essentials for surgery from other hospitals like Mill Park. What's your response to that?
I mean, it's, you know, we have processes that we follow in terms of procurement and monitoring, and I think it's a big problem that we're talking to here. It starts literally with people monitoring the stock that is available and putting orders on time, and we do understand the processes of ordering can take a bit of a while. So, I mean, it's not just one thing that is there, it's a myriad of issues that surround that. But I think it's really unfortunate that we've had to cancel a few just because we did not have the suitable consumables to do that. But I mean, one of my own ambitions for this hospital is to actually get the stock monitoring systems in place so that we cannot find ourselves in such situations when we run out of essentials that we really need for surgery and for any other running of the department. Yeah. So it was a problem, but we've managed to sort that out very quickly and be able to get also the essential equipment and consumables that we require.
We've spoken to a number of people, including Louise Turner, who I think greeted you this morning as well, and who you've spoken to as well. And, you know, I asked her about your tenure as CEO and perhaps the challenges that you face from her vantage point. And she describes it as you're in the midst of a rat's nest insofar as the challenges at Helen Joseph is concerned. Now, I know that you have your job as CEO, and there are certain PR principles that you will follow in our interview this morning.
Sure.
But can you be as honest as you possibly can with us this morning? Take us into your confidence about some of the challenges that you think you face still as CEO.
Look, you know, if you look at a hospital, you need to be looking not only at a building, this one building, but you need to take it into a context of the whole health system. So there are challenges in every aspect of it. I mean, I think that has been quite clear. And I think the issue or the challenges that we currently face is to make sure that within these constraints that we find ourselves in, we are still able to continue with services. I mean, we are constrained and save lives. You know, I mean, our mandate is to have good outcomes for our patients. I don't think there's any healthcare worker who'd wake up in the morning, come to hospital, and at the end of the day, not be pleased with saving lives. So, I mean, that's the type of attitude that I'm trying to push across. But yes, the limitations that we have, staffing limitations we do have, a few infrastructure limitations we do have, but we try to work within those to try and get our services to continue. I mean, we know that a large population of South Africa depends on the public health system, and we are here to ensure that we're able to deliver that to the best of our ability. It is a tough job. Every single day you are faced with challenges, but if you have a team behind you that works in a health department that supports you in the mission that you want to accomplish, we will be able to get somewhere.
Yeah, I mean, you talk about operating in an environment, and Gauteng Health itself is, fair to say, this is fair comment, in a crisis at the moment. Corruption is perhaps at the top of that list. Perhaps second on that list is cancer treatment in the province. So for Helen Joseph, where we are this morning, this is for diagnosis and this is for surgery, right?
Yes.
What happens at the stage of referrals for chemo and radiation to Charlotte Maxeke Academic Hospital?
So we are clustered with Charlotte, and they do provide our patients with chemo and radiation. I mean, the referral processes are the same. We will diagnose here, get to treat them, and if they do need radiation at that particular time, we then refer them to our oncology department at Charlotte. The referral for me is clear. I don't think there are any problems. Of course, we need to consider the backlogs that they have as well.
Right. 3 years.
So we need to, you know, I mean, also what we do is the clinicians do gauge the patients, interview the patients, examine the patients, and be able to stage the patients and then be able to prioritize them. So, I mean, the truth of the matter is that, yes, it is a bit of a chock-a-block type of a situation, but our referral pathways between the two facilities is good.
Yeah, the waiting list, we're told, for radiation and chemotherapy at Charlotte Maxeke up to 3 years. Of course, that's life-saving time. Dr. Relebohile Ncha, let me thank you for your time this morning, the CEO of Helen Joseph Hospital. As we continue this morning with our special focus on cancer treatment in Gauteng, of course, it's all part of our coverage here on the AM report of Breast Cancer Awareness Month. Ayanda?
Michelle Craig, thanks very much indeed. That was there from Helen Joseph Hospital in Johannesburg. And yeah, as she mentioned, we'll continue watching this incredibly important issue affecting so many lives in the province. But also